Hello, everybody. My name is Todd Kuckkahn. I'm with the Portage County Business Council. I'm excited to partner with Portage County Health and Human Services and everybody else on this call to bring us some more information regarding our health situation and particularly some of the news regarding vaccines. So with that said, I'm going to turn this over to our county executive, Chris Holman. Chris, go ahead.
Thanks, Todd, and hello to everybody, and thank you to everyone tuning in to watch the town hall. I'm certainly glad that you've taken the time to join the conversation, and thank you too to our panel of guests who have graciously volunteered their time. My name is Chris Holman. I'm the Portage County Executive, and I'm happy that we're all here today because, as we all know, each new stage of the pandemic has presented unique challenges on an operational and policy front, but that has probably been most pronounced when it comes to communication, education, and outreach, whether it's at the national, state, or local level. The town hall events we put together over the past few months are a great opportunity to bring a panel of experts like this one together to discuss the issues of the day. Now that we are a couple of months into the national vaccine rollout, forums like this can also help demystify some of the processes in play. These days, help people understand why vaccine supply is limited, how the CDC, Wisconsin Department of Health Services, and local vaccinators like our pharmacies, hospitals, the county's Division of Public Health are all working together to ensure that everyone in Wisconsin who wants a vaccine gets one. I know that today's conversation will be able to shed a lot of light on these issues, and in order to facilitate today's conversation, we asked members of the public to send in their questions beforehand. Before we get to the questions and answers though, the members of the panel will each take some time to discuss who they are, what they do, how they're confronting COVID-19 in their worlds, and what challenges they've run into. We have an excellent panel with us today, and I'd like to thank them all again for being here because I know that they are all exceptionally busy. Thank you too to the Portage County Business Council for working so closely with us on these town halls. We're very fortunate to have them as a partner in all of this. So those who are watching are aware, if we do end up not getting to every question that was submitted, we will be sure to get answers to those questions, and we'll post those along with the video for the town hall. Of course, members of the public are always encouraged to reach out with any questions they have, so please continue to do that too. So thanks again for watching today's town hall. And with that, let me introduce our moderator, Amy Eddy. Amy is a certified elder law attorney who works locally at Anderson O'Brien. And on behalf of all of us, I'd like to thank her for helping move the conversation along today. So Amy, take it away.
Thank you, Chris. I'm going to go ahead and start by introducing our panel members. For those of you who have been watching the virtual town halls that we've had in the past, this is our third virtual town hall. And these are the panelists who know everything COVID. We've talked about everything from testing to contact tracing to what's happening in our elementary schools, high schools, universities. And this town hall is really meant to focus on the vaccine response and kind of the status as to where we are right now. So in no particular order, I'll ask everybody to just give a little wave since everybody's muted and their names are on there. Our panel members are Ray Przybelski from Portage County Health and Human Services, Gary Garske, Portage County Public Health Officer, Chris Holman, who you just heard from, our Portage County Executive, Dave Ray, Portage County Counsel, Bob Smith, Vice President of Aspirus Stevens Point, Dr. Helen Luce, Director of Student Health Services at UW Stevens Point, and Dr. Michael Clark, Emergency Medicine Physician at Ascension, and finally, Representative Katrina Shankland from our Wisconsin State Assembly, who I believe is with us for the first time on our panel, so thank you for coming. So we have in the past talked about the various roles of our panelists. Those are available to you, and I think everybody's fairly familiar with the panelists at this point. I'd like to just jump right into the questions. And I'd like to start with kind of the mask question. I feel like I hear something different every day about what are we wearing masks? Are we not wearing masks? We're wearing masks. Are we supposed to wear 2 masks? What's better? How long are we going to need to wear them once we have the vaccine? So Gary or Bob, maybe one of you could speak to the mask issue. Are we supposed to be wearing 2 masks, and are we supposed to wear them after we get the vaccine?
I can start. So again, Keeping in mind that, yes, once you're vaccinated, the expectation is that you will still need to wear a mask until we get that 80% herd immunity built up into our population. For Wisconsin, that's going to be about 7.4 million eligible adults to be vaccinated. The goal for that to happen is sometime towards the end of August of this year currently, depending on vaccine supplies. As far as the double mask question, it really is depending upon now the variants that we're seeing coming out from the UK variant, which again, we saw a second case of that in Wisconsin this week in Waukesha County and also in Eau Claire County, as well as other variants like the South African variant. And in those cases, CDC has made recommendations that double masking probably would be the best until we know more about those variants and how they're spread as far as an extra level of protection. And again, you know, with the vaccine itself, the vaccine is yet another level of protection. But again, with that said, it still is required to be masked, because if you are, even though you're vaccinated, if you should come in contact with a known positive case, you will be asked to serve quarantine.
Now, one of the other questions, Gary, if you wanted to continue on the variants, or maybe Bob, for anybody who's heard about those, what are the concerns that we should be thinking about with those new variants?
If I can, I'm gonna let the medical professionals speak to that.
I can try to answer that. Well, the new variants, it's limited information. So because we don't have a whole lot of details on those variants and how effective these vaccines are going to be against them, it's using the mask and using the social distancing and the precautions that we've had in play for a long time. So as Ray outlined, it's very critical and very important that you continue those until we conduct studies and have a better understanding of how the vaccines currently are going to affect or be effective on those variants, and additional variants may be coming forward too as this goes along. So play it safe, wear that mask, hand washing. I mean, you look at the effectiveness of the mask wearing, the social distancing, the hand washing, just from an infection prevention standpoint of other diseases. Influenza is basically non-existent right now. So we know this is working, and it's an effective preventative measure that we should keep in place until we learn more about these viruses.
And Bob or Michael, from the medical perspective, there are a lot of questions related to the vaccine itself. So there's questions about what the side effects are, why it's necessary to get 2 doses, and what is the process for people to become eligible to get the vaccine? What do they specifically need to do? And I know that's 3 questions, but they kind of overlap.
I can start with the side effects. I mean, I think the side effects from the COVID vaccine are similar to many of our other viral vaccines, such as influenza. Probably the most common thing is a sore shoulder, kind of where they administer the vaccine. But then, you know, we kind of have this viral response, which is common to kind of all viral infections and some bacterial infections. So that's the fatigue, body aches, those types of things. You're just not feeling well. Sometimes you can have a low-grade fever with that. And then there's some rare side effects. Sometimes people get some GI symptoms. You shouldn't typically see a cough or, you know, like an active respiratory infection with it, but kind of these generalized things that go along with it. Headaches are not uncommon. And there's been some, you know, obviously reports of some allergic reactions, which are relatively rare. I mean, really are not. We hear about them. They're concerning. But, you know, all vaccines, really any medication has a risk of, you know, some type of allergic reaction. It could be from the vaccine active ingredients, or it could be from some of the inactive ingredients that help preserve the vaccine or help are a carrier for the vaccine. So it's, you know, not they can be bothersome. I mean, most people have relatively mild side effects. People find that usually the second dose does cause a more significant set of symptoms, but usually these last 1 or 2 days can be mitigated with taking ibuprofen or Tylenol. You develop these symptoms, and in comparison to having a full-blown infection, are usually relatively mild.
And then in terms of the 2 doses, one of the questions is why do we need 2 doses? And then what is the level of protection, if any, from in between the first dose and the second dose? Or is there some kind of lag time even after that for the effectiveness.
Yeah, and I think like many of our vaccines, that as children we get, there's MMR, some other ones you get multiple doses. It's basically just to kind of build that immune response within your body to know that you're going to have an effective immune response if you were to see the actual virus kind of in an infectious state. So there is some protection after the first vaccine. Increases significantly with that second vaccine, and it's felt to be about 95% effective with the two current vaccines about 2 weeks after receiving that second immunizations. And part of it is this was felt to be the best level of protection by the people developing the vaccine, and this is what the trials are based on. So it's hard to say exactly what your protection is after one, because that wasn't necessarily studied. That wasn't the primary outcome, and they're pretty close in proximity. So there's not a lot of people who happen to get sick in those who get exposed in that 21 to 28-day window. And it's really to provide the best immune response possible to the vaccine.
So by introducing that second dose, you're increasing your immune response because you've had it twice.
Yes.
I mean, theoretically, you could keep going, but we can't vaccinate every month for the same thing.
And that's why people typically have that some of the more significant side effect from the second dose is their body is seeing that for the second time it's mounting a higher level immune response, causing some more of those non-specific generalized symptoms that come along with a viral infection.
And so then how do people find out, number one, if they're eligible, and then who do they call? What do they do? What is the process?
So, I think the eligibility has been outlined by the CDC and the Department of Health Services at the state level on what populations are able to get the vaccine. So currently, we've gone through frontline healthcare workers, some of the, some tiers of the essential workers, and then, obviously they're going to be expanding that March 1st. There was an announcement, and then those greater than 65 years old. I think each of our health systems is working through, the best way to vaccinate, especially that 65 plus population. That's a broad population, and primarily is kind of going through your primary healthcare provider. I can speak to Ascension. They're basically reviewing their patient list of everyone over the age of 65 and basically risk stratifying them the best they can. Starting with the higher risk patients, reaching out to them to have them schedule that appointment, and then kind of working their way down the list. And I'll let Bob speak to what how Aspirus is handling that population.
And what's the process for Aspirus, Bob?
Yeah, for us, it's a process where we've got this listed out on our website. It's the preferred method, and there's a sign up. So there's a button out there under COVID, and there's a sign up place where you go and put in your contact information, and then we call you back and validate what's the closest vaccination site for your residency, and then we schedule you for that vaccine at a time that's appropriate for you. So it's not just Aspirus patients. This can be anybody in the public can go to the website and sign up through that process. Now, for people that don't have access to the internet, you can still use our COVID hotline and call in, and we'll facilitate the process through that hotline as well. So we know there are residents out there that may not have internet service or access to a computer, and we'll facilitate that process through that hotline as well.
What is the recommendation for people who have already recovered from COVID-19 in terms of getting the vaccine?
The recommendation that we're bringing forward is to get that vaccine yet. Again, to Dr. Clark's point earlier, there's just not enough longevity to these studies to know if somebody who has been positive with COVID and has antibodies, whether they can or can't get that again, and whether that vaccine is going to bolster that. So we're recommending to go ahead and get that vaccine.
Yeah, and some of the studies did show actually a better immune response in some measures after getting the vaccine versus a native infection. I think and the only other caveat is that if you receive some of the immunotherapies directed towards COVID, you need to wait about 90 days to make sure that kind of those immune medicines have cleared your system to allow you to mount the appropriate response to the vaccine.
And for people who have concerns about getting the vaccine, what's the best resource that they can look at for more information?
Well, I've said this, CDC is a great place to look this up. I think some of the other larger research facilities, some Mayo and Hopkins and things like that, some reputable sources. So be careful where you're getting it. Look for reputable information and check with those sites preferably, I would say.
Yeah, and I think, all of our health departments and healthcare systems have COVID information either directly or links to the, link to the CDC or these larger websites, to provide information. And then all of your healthcare professionals, if you have a specific question about your condition and you're reaching out to your primary care provider or your specialty care provider to discuss any unique medical concerns, that'll be your best place to get that, patient-centered information.
Okay, so thank you for that. Switching gears a little bit, I want to talk about the vaccine rollout. There are some questions about how it's rolling out in Wisconsin and then how it's rolling out specifically in Portage County. One of the questions, indicates that on the Department of Health Services website, that per capita Portage County is behind the state average. And in some of the neighboring counties, I'm seeing that data change frequently as well. I think on the state level, it was lower, now it's higher or bumping up. Katrina or Chris or whoever would like to jump on that one to talk about how that's rolling out in the policy.
I can speak to the state level. So specifically, there have been a lot of questions about vaccine distribution. There was also a public hearing in the legislature regarding vaccine distribution. As of February 8th, Wisconsin is now leading the nation in the average number of COVID-19 vaccine shots that are being administered daily. As of February 10th, Wisconsin has given over 1 million COVID-19 vaccine doses. So on a 7-day rolling average basis, Wisconsin is now administering roughly 6,170 shots per million residents per day. And about 14% of the population, that's 823,000 people, have gotten at least one COVID-19 vaccine dose, according to our State Department of Health Services. And almost 184,000 people have gotten a second dose, completing that 2-dose vaccine series. 37% of Wisconsinites who are age 65 or older have been vaccinated, and that group accounts for about 700,000 people. Currently, the state is expanding its rollout to include free vaccination clinics across the state. The first clinic is set to open in Janesville on February 16th, and the state will add up to 10 additional community-based vaccination sites statewide as needed and as the vaccine supply allows. I think a lot of the confusion over the last few weeks and a lot of the questions regarding vaccine distribution primarily had to do with the supply issues that we're facing. At the public hearing on vaccine distribution, it was emphasized that our supply issues were a significant challenge. Since then, the State Department of Health Services has publicly stated that there has been better communication from the federal government about how many doses the state will receive every 2 weeks, which allows for better planning. While at least one bill was introduced in the legislature to alter the state's vaccine distribution plans, so far that's only passed the state assembly and the Senate Health Committee hasn't taken it up. But on the state level, we've improved greatly over the last few weeks.
And how about on the county level? Is that, is there a disparity between other counties in Wisconsin that Portage County is lagging behind on supply?
It's a good question. I mean, it's one we get a lot too, but we're essentially at the end of a very long chain. So the supply side questions, those are answers that we have to look to other people for. And as Katrina was saying, that's been improving recently, and I expect it to continue to improve. The process is relatively involved and involves, advisory committees at the CDC level who provide recommendations to the state level kind of equivalent, who then provide recommendations to DHS, and then they issue their recommendations or guidance to all the local vaccinators. And, those steps are really important because as we're seeing, it's really crucial that it is a national rollout plan with state involvement all the way down to us local vaccinators, and everybody should be on the same page. Everybody should be rowing in the same direction, and we're definitely making a shift towards that, and that's really good to see. Locally, the county to county comparisons, we've received questions on that too. DHS has a variety of different priorities. There's an emphasis on equity and distribution as well. Some of the tools that they use are like the Social Vulnerability Index that the CDC has. There's also priority for some of the larger healthcare systems, most likely just because of location, population centers, and infrastructure. So it's not on a per capita basis. It's not really a uniform sort of distribution so that you could compare it in an apples to apples kind of scene. For us, the model right now with Pfizer and Moderna, because there's logistical concerns with the temperatures that you have to maintain as these are shipped around the country. It's a hub and spoke model. So our regional hub is at the Marshfield Clinic. And just as an example, in Portage County, any individual vaccinator, including the County Division of Public Health, we're just one of the spokes. And so each vaccinator will, every week make its request to DHS, and then DHS will tell us by the end of the week what the allocation we'll be getting will be. And that helps us kind of plan for the next week. I know that DHS is looking to kind of expand that planning envelope so that we can get 2 weeks at a time allocated. And that way, you're not always behind the 8 ball in terms of, do we hold a mass clinic on Saturday? Do we do a mobile clinic here? So that will really improve things too in terms of having more certainty with what we're receiving. Generally speaking, I think there's 1,500 vaccinators across the state right now, and I think right now we're seeing 72 to 82,000 82,000 doses of vaccine available per week. So that's where we are now. Even though I would say too, even though vaccine supply has been limited, we're still doing very well with what we're receiving. There's no wasted doses. They're going into arms. And even, just as an example, each DHS has set out kind of percentage goals of population for different vaccinators. So local health departments are looking to vaccinate 14% of the population wherever they are at, like in the county. So for us, we've managed to still get to 10% of that goal from DHS despite the strained supply. So we'll continue to see the positive trend in terms of an increase in doses. As I understand it, I know we at the county level, but all of our peers and partners across the county and the region, we have plans that are ready to go. So once the supply line really increases, we'll be able to implement those plans and get things going.
So it really starts with that supply. So you can't really set up vaccination clinics and have ongoing, an army of vaccinators if the supply is lagging.
Correct.
While we're on the policy and kind of back on the state level, Katrina, can you speak to the current emergency order mask mandate that's kind of gone back and forth, and also whether or not there's any pending COVID relief on the state level, any legislation that way?
Sure. So let's start with the mask order and the public health emergency. So on January 26th this year, the state Senate voted to end the state's public health emergency and the corresponding mask order, and that is Senate Joint Resolution 3. They sent it over to the state assembly. The state assembly was originally going to be voting on it much sooner. They took a little bit of time to evaluate the corresponding loss of federal funds. If we were to end a public health emergency, any federal money predicated on a state health emergency would also be lost. The state assembly took this up on February 4th and voted 52-42 to end the state's public health emergency and overturn that mask mandate. At the same time, they amended one of the state's COVID-19 relief bills, Assembly Bill 1, to change the public health emergency. And I can talk about that when I talk about the COVID-19 relief bill. So because the joint resolution ended the state's public health emergency and overturned the mask mandate, Governor Evers declared a brand new public health emergency and issued a new mask order, setting it to expire on March 20th, 2021. And since then, a legal challenge has been filed. It's important to note that a previous legal challenge to the mask mandate was heard by the state Supreme Court in November 2020. They have not ruled on it yet. And so the mask mandate and public health emergency are therefore still in effect. That could change in the coming days. It's important to note that regardless of the state Supreme Court ruling, local governments, including counties and municipalities, can still set their own orders regarding mask requirements. Individual businesses could also require masks regardless of whether or not the public health emergency is enacted. And some communities across the state have recently enacted mask orders as a result of the uncertainty. When it comes to COVID-19 relief, the first bill that was introduced in the legislature was Assembly Bill 1 to respond to the pandemic. And as a lawmaker who's introduced and co-authored legislation throughout the pandemic to provide both relief and assistance, I am frustrated that it's been 10 months and we still don't have a COVID-19 relief bill passed into law. Originally, the governor and the state Senate agreed to a compromise bill that was bipartisan, and it related to unemployment insurance, health providers, and more. It was very similar to the first bill we passed in April 2020 on necessary COVID relief. But the state assembly amended the bill. They included provisions that would prohibit employers from mandating vaccinations, limit the actions that a public health officer can take, and eventually amended the bill to limit the governor's ability to declare public health emergencies, specifically related to that issue I mentioned with federal dollars. And so this was no longer a bipartisan compromise bill. The bill went back and forth between both houses to the extent that neither house nor party agreed at one point. And eventually when it did pass, the governor vetoed it and called for the bipartisan compromise bill to make it back to his desk. So because these amendments were really not bipartisan, I think what we need to do is get back to that original bipartisan compromise bill. And I'm committed to pushing for COVID-19 relief, and will continue to advocate for that original bill to pass.
Great, thank you. One more question on vaccines. Gary, there's a question about whether or not there's been conversation on the public health level with employers about vaccines and vaccine requirements. Are there conversations about that, about mandating vaccines, or what employers should be doing?
So again, that question comes up a lot lately. And again, it's all about as we're moving through these different phases of eligibility and folks preparing to be a part of that next phase of being eligible. At this time, as far as I know, it really is up to the employer whether or not they want to mandate or not mandate vaccination. That is a question truly within their own organization that can only be answered within that organization. As far as what they can do, again, as folks are becoming eligible, for example, right now we're working with the educators because they're kind of the next on the list after the 65 plus group. And hopefully by March 1st, is to start working with your organization, with your members who would be eligible, to ask them, do you want to receive the vaccine if it were eligible? And if so, to create a roster. And then that helps us, whether you're going through public health or going through your medical provider, it helps to have a number as to how many doses you will need, so that when we make those requests through our allocation surveys, we know exactly what to ask for, and to see that we can get you those vaccines set up with some kind of clinic and or immunization, either at your work site or through your provider. So that's really some of the first things to do. I will tell you that there has been some hesitancy in folks receiving the vaccine. And typically we're seeing about a 30% hesitancy right now. Some people feel it was rushed. Some people feel it's just too new. And really, I think you always have the folks that kind of stand back and watch others, and then when they feel comfortable, they will move forward and say, yes, I want the vaccine now. And we've seen that as well. So it's really, this is the time that we're making the most of education to let people know exactly, like this conversation, what are the possible side effects? What are the expectations about receiving vaccine? Why do I need 2 doses? So getting those questions answered so people can make really an educated choice for themselves as to when they become eligible to receive it.
And talking about educators, targeting that date in March, some of the questions relate to when school will resume in person 5 days a week. And that's really different depending on whether we're talking about elementary school, whether we're talking about secondary. We don't have anybody from the local school district. But Dr. Luce, what's going on at the university in terms of in-person on campus, virtual?
Sure, I can answer that. So we started in the fall semester with quite a few of our classes actually were designed to go online only. We did have some hybrid classes so that they started with in-person, but with reduced capacity and in larger spaces so they could spread out in the classroom. So what they found is that actually that worked very well. And we had no cases during the fall semester that we could trace back to classroom exposure. So for spring semester now, they actually increased the number of in-person classes. The biggest problem is finding large enough spaces to be able to adequately physically distance in that space with larger, especially larger, college lecture, big classes that have 100 or more people. That's just a very difficult thing to accommodate at this point. But a lot of the smaller classes are able to accommodate just in maybe other spaces on our campus. We've actually made classroom spaces out of areas that otherwise were not used for classrooms. Our big, the big MAC, where our indoor track and field is actually used as a classroom space for some of the larger courses, as well as the layered room and some of our bigger meeting rooms. So that has been successful so far. We are starting to plan for fall of 21, but that's quite a ways off and hard to predict at this point what we're going to see in terms of where we'll be with vaccination and herd immunity. And but we're hoping to have even more in-person, get back towards more in-person learning at that point.
And for the junior high school students, are there conversations about what parameters we would have to reach? Is it the vaccinations of the educators? Is it we're just going to close up shop and wait till fall? What are those conversations like? Gary or Chris? Or are we?
Or Ray? Ray, do you want to take
or
this?
Ray, yeah.
Well, that's a great question. We know that across our county, we do have school districts that are going to school 5 days a week right now. A majority of our elementary kids are going to school 4 days a week, and there's a variety between 4 and 2 days a week at the secondary level. I think that in our conversations, I think it's a district by district decision. We do know that a number of the districts are looking at trying to get their staff vaccinated before they're going to be comfortable going to 5 days a week. But with the amount of virus that they're seeing in their schools, which has been decreasing, we believe that everyone is certainly looking at by the fourth quarter of trying to be 5 day a week in-person education. As we all know, that in-person education is obviously their gold standard to provide education to our children.
And related to that, Ray, I imagine that this has become an issue all through the whole pandemic and everybody being isolated, but what's happening in mental health and what's being done to address that?
Yeah, that's a great question. So, we know that whether it's that individuals aren't being able to do their normal activities or they're just feeling isolated, that that is impacting individuals' mental health. We are encouraging people and have had conversations with all of the providers, that school providers and private providers that are in our community, that they are aware of this. We are making people aware that we have a 24/7 crisis line that they can reach out to. There's also an ability to text if people don't want to make a phone call. We want to encourage people that it's that what they're experiencing is kind of a natural consequence, if you will, of what's been happening. That there's certainly no shame in reaching out and trying to talk to somebody when you have these feelings of whether it's anxiety or possible depression, because of what's happening. We want to, we want to encourage people to reach out and get that help. With that being said, we know that we have had an increased number of referrals to our outpatient mental health clinic here at Portage County Health and Human Services, but Some good news with that is that we were just informed that, the governor is going to introduce in his budget $150 million influx in mental health treatment, for the next biennial budget for across the board for a variety of different things. And we're hoping that survives, because that'll again help all of us provide the needed mental health services for people in our communities.
Yes, very much needed. One final question that's on the list actually has to do with testing. And I think this is the first time that we finished all of our questions on the list in the time allotted. But I do want to ask this question. It says there has been talk about the viability of PCR testing and the number of cycles being used, leading to false positives. How is Portage County doing their PCR testing, and how many cycles have been used in the past compared with how many are being used today? So if you could explain what PCR testing is in the first place, and then how does that relate to false positives and the number of tests that you're doing now?
I'll take a stab at this if I can. Go ahead, Gary. Were you gonna go ahead?
I was gonna say, go ahead, because I can tell you about our PCR testing, but I don't have the medical background you have.
Well, and again, what I did was I saw this question, researched it with our director of our lab services. So the answer that he gave me is that we've got various PCR testing capabilities. Our labs are doing different tests. Now we've got like 3 different manufacturers or testing devices that we're using. Each one of those devices, though, because of this pandemic and the need to bring these forward in such a short amount of time, they were approved by the FDA with a very narrow scope. So these cycles are prescribed pretty tightly by the FDA for each one of these tests. So we don't have the ability to manage the cycling any differently than what the FDA has approved for each one of these test kits.
So all of the test kits are different types. There's various types of tests.
There can be. Some labs have access to a large quantity of a single type of manufacturer. We've chosen to go with 3 different manufacturers is what we've got. So we're using those in our various labs across our system.
And these are the rapid tests, so-called rapid tests that can have the false positives.
Correct. And again, the cycling in these early studies was to detect that virus as early as possible. So they really wanted to be super sensitive and pick that up early on so we could manage those people effectively without having them transmit this virus. So early on, as that patient starts to shed or the public starts or the person starts to shed that virus, we want to pick that up right away. So they are very, very sensitive in that way. And then also on the back end, after that person has had that virus and perhaps is not shedding or putting off that virus anymore, it still can remain in the system, and we're picking that up. So there's a 90-day window afterward that our PCR testing is not recommended because it's likely going to be positive for you.
And I don't think there's been any changes to any of the cycling or any of the test characteristics. Like you said, these are all defined by the manufacturer and the FDA with the emergency use authorization. So we're using whatever test we're using, the standard hasn't changed throughout the pandemic.
You're not messing with the cycling because you're trying to figure out that you're just doing what the manufacturer recommends for that particular test.
There might be a change in test, which test someone's using at one time, but if we're using test A and we're still using test A, nothing's changed about the parameters of test A.
Gary, did you have anything to add to that?
I would say, so at Portage County, we're using two different types of PCR testing. One is done through our Wisconsin National Guard testing site. That's on Mondays at the Portage County ADRC. And they're using a nasal swab that's put out by Exact Sciences out of Madison. And then we also staff a community testing site on Thursdays. And we were using the Mako brand based out of North Carolina, also a nasal swab. I think just looking at this panel, I think we have a variety of different PCR testing that we're using either in our places of education or our work sites or our medical offices. And really also for residents of Portage County, there's lots of testing opportunities, whether it be PCR testing through your medical provider or public health or the university for PCR confirmed testing. But there's also the antigen testing that's available through the university right now, locally Wednesdays and Fridays, which is a rapid test. It will give you a result within 15 minutes. And then for other folks that have possibly even been vaccinated, there's always the serum test or the antibody test that's available through your medical provider as well as some local pharmacies. So again, just in Portage County alone, you have 3 different types of testing outlets available to you.
Great, thank you. I think we've covered all of the questions that were sent in. Thank you to all of the panelists. It was very informative as always.
Okay, well, for the end of the session today, I just want to say again how much I truly appreciate the time our panel took out of their day to be here. Thank you to everyone who has tuned in to watch, and also thank you to those who sent in the questions for the panel. They're very good. As a reminder, you can find the latest COVID-19 information, daily press releases and updates, and much more on the Portage County website, which is at co.portage.wi.us. And there's a banner at the top of the page. It'll bring you to the COVID-19 page. But also in the bottom left corner, you'll see in the spotlight section. And we put a lot of important kind of breaking big news out there. And that includes information on the vaccine rollout here in Portage County. The Division of Public Health has their Facebook page where they put out a lot of information on a daily basis, as well as on the COVID-19 dashboard, where a tremendous amount of information and links to others at DHS and CDC are available. If you have further questions, please send them in to the countyexecutive@co.portage.wi.us email, or give us a call at 715-346-1997, and we'll get back to you as soon as we can. So thank you again. Please remember to wear your masks or face coverings, be safe, and continue to follow all CDC, DHS, and local health department guidance. We're still in the midst of a serious generational challenge, and we need to redouble our efforts so that we can get through it together and get our community, our county, our state, and really our country closer to the new normal we've been adapting to as we've lived through this pandemic. So take care of each other and be well.